Hello everyone, good afternoon. I am Dr. Pranitha Reshmi, consultant Infertility Specialist, Sudha Fertility Hospital, Banjara Hills, Hyderabad. Thank you for joining me today on this Facebook Live. Today we are going to discuss a very important condition that affects millions of women in the reproductive age group that's often mistaken, that is endometriosis. So it not only causes the severe pain, but it is one of the leading cause of infertility. So let's discuss today about the endometriosis. So what is this endometriosis? Endometriosis, let me explain you simply that in an uterus, inside the uterus, there is a lining called endometrium. So this tissue will grow every month and sheds during the period. But what happens in this endometriosis is the inside lining, instead of being there in the uterus, it occurs outside the uterus. Like it can implant on the ovaries, or it can implant on the fallopian tubes or pelvic side walls, or it can even implant in the on the intestine, small intestine, large intestines, or even on the bladder. So during the periods, what happens is this lining, it sheds, it bleeds, and the blood has no way to go outside the body. So this collected blood causes the pain, and it can even causes the severe inflammation and scarring of the tissues. So the endometriosis is a pathological condition that needs to be treated. You may ask me, doctor, how can I know that I have this endometriosis? So the most common symptom with which the patient presents with endometriosis is severe abdominal pain during the periods. So the pain is so severe that the school-going girl or the working woman, they fails to attend their duties and they need to take the painkillers. So the pain is so severe. Or sometimes what happens, the married couple, the married woman comes to us telling that she has pain during or after the intercourse. Or sometimes what happens, they have chronic means very prolonged lower abdominal pain that is outside the menses, or sometimes the patient may present with infertility. Suppose if you are having any of these symptoms, better to consult an infertility specialist and get evaluated. Then how can I know that I have the endometriosis? So what are the diagnostic tests that tells us that the endometriosis is there in your body? The most commonly we diagnose the endometriosis based on the symptoms. Suppose if we are having above symptoms, so come to the infertility specialist. We'll do the basic tests like ultrasonography to check for any chocolate cyst, what we call as endometriotic cyst, or suppose sometimes the disease is so severe that we may even advise the MRI. So this MRI test will show us the extent of the disease as well as the severity of the disease. Sometimes what happens is we may even ask for the laparoscopy. Laparoscopy is the gold standard testing in endometriosis. The laparoscopy is just like a keyhole surgery where we see the pelvic side walls, and as well as in the same sitting we treat the endometriosis. So here comes the very big question, like how does endometriosis causes affect the fertility? So this endometriosis during the period, what happens is there is a collection of the blood in the endometrial cavity in the uterus. So what happens is outside the abdomen, like outside the uterus, there is a collection of this blood. This collected blood causes the scarring of the tissues. So it affects the fallopian tubes. There may be blockage of the fallopian tubes, or sometimes the ovary get attached in the abnormal position in the outside in the abdomen. It may even attach like in a very abnormal position. Now, sometimes what happens is in the endometriosis, it may produces some chemicals that creates the hostile environment for the egg or for the sperm or for even to the embryo. So the endometriosis, it can go up to certain extent that there are some studies which tell that the egg quality is also decreased in endometriosis. So whatever may be the cause, that endometriosis, once it is diagnosed, it should be treated. So, what are the treatment modalities that are available nowadays for the endometriosis? Most of the patients, they come to us with severe pain, so we give them painkillers, or sometimes we give them medication like hormonal medication to reduce the pain, like progestin injections or GnRH agonist injections, or sometimes we put them on contraceptive pills to reduce the pain. So the main drawback of this medication is they reduces the pain, but they doesn't improve the fertility. So what are the other treatment modalities that improve the fertility in case of endometriosis? Suppose in case of mild disease, we advise the patient to go for surgery. So we remove all the endometriotic spots, and sometimes we advise the patient to go for IUI. Suppose if it is severe or moderate to severe disease, then laparoscopy is the main modality. Or suppose if the disease, even if it has gone to such extent that there is a blockage of the fallopian tubes, or sometimes there is a decrease of the ovarian reserve, then we advise the patient to go for IVF. So IVF not only bypasses the hostile environment, but it also improves the success rate. Then here comes like are there any lifestyle modifications that can improve the endometriotic symptoms? So definitely the endometriosis is not only the physical problem, but it also affects the relationships, it also affects the mental health of the patient. So the lifestyle modifications like taking the healthy diet, taking omega-3 fatty rich foods, or avoiding the processed foods, having adequate sleep, and reducing the stress. These are the some modifications that we need to do, lifestyle modifications that we need to do for in cases of endometriosis. These lifestyle modifications, they regularize the hormones as well as they reduce the symptoms of endometriosis. So the main thing, like main 2 points I want to stress, that is the endometriosis can reoccur. So the endometriosis should have the lifetime follow-up, as well as for those women who want to delay the pregnancies, and once they are diagnosed with endometriosis, they have the option of fertility preservation. Like they can preserve the eggs so that they can get the pregnancy once they want to get pregnant. So there is a fertility preservation option also, that egg freezing. So these two should be considered when planning for a pregnancy. And the take-home message for this endometriosis is like, once you have the severe pain, it is not normal. So better to consult an infertility specialist and get evaluated. So endometriosis is nowadays a leading cause of infertility. So don't neglect that, and consult an infertility specialist. Early diagnosis and treatment will cure, or there is no cure, but it makes the infertile couple to get pregnant early. So never neglect that if any infertility patient along with endometriosis, these type of symptoms what I have said, so better to consult an infertility specialist and get treated early. So now we'll see if any questions are there. So I am 29, newly married. Doctor said that I have endometriosis. Should I plan pregnancy quickly? Yes, definitely. Even though your age is 29 and newly married, this endometriosis, what happens is it decreases the ovarian reserve. It damages the normal ovarian tissue. Okay, it damages the normal ovarian tissue, so in turn decreases the ovarian reserve. So that's why better to plan your pregnancy early. Can endometriosis be cured? See, there is no cure for endometriosis. Once endometriosis is diagnosed, we have the treatment modalities to suppress the endometriosis, as well as we have the treatment modalities to like bypass the endometriosis condition, so that the treatment which we are planning for it should be individualized. Every patient is different, they should be individualized treatment. So based on your condition, we suggest the treatment. So there is no cure for endometriosis. Will it reduce the amount of healthy eggs? Definitely. There are some studies which are telling that even the egg quality is also decreased in endometriosis. So better plan your pregnancy as early as possible once the endometriosis is diagnosed. If endometriosis is stage 4 means that is a very high grade endometriosis, and surgery is done. Will it leave scars in the uterus that may cause infertility later? Yes. So endometriosis, the grading of endometriosis is also very important here. Grade 1 and grade 2 endometriosis is the mild grade, whereas the grade 3 and grade 4 endometriosis is a very severe form of endometriosis that even it affects the bladder. They may be having the urinary symptoms also, or sometimes they may have the bowel problems also. So if the endometriosis is affecting such like adjacent structures, so even the uterus is also affected, and sometimes what happens is this endometriosis even get implanted on the scar tissue, that what we call as scar endometriosis. So these all conditions should be treated early. Does endometriosis go away after pregnancy? So, as I said before, that there is no cure for endometriosis. Only the thing is we can reduce the severity by giving some medication. But once you plan for pregnancy, there are certain medications that we can't give, like oral contraceptive pills or progestin injections. We can't give when you are planning for pregnancy. So, better you tell the patient, approach you are planning for pregnancy. There are some other medications that we need to give to the patient when you are planning for pregnancy. Yes, can food and lifestyle reduces the endometriotic pain? Yes, because in the food and lifestyle also impact the endometriosis. Means it reduces, to reduce the symptoms of endometriosis. We need to get adopted to the very healthy lifestyle, because this healthy lifestyle will regularizes the hormones that are there in the body. So definitely, the lifestyle modification, like having the healthy diet and having adequate proper sleep, as well as exercise, yoga, meditation, all these factors will reduce the symptoms of endometriosis. So, do endometriosis always need surgery to be removed? See, there are two schools of thoughts that if we do repeat surgery, some patients may have the endometriotic cysts, like chocolate cysts in the ovary. They may need repeated surgery. But one thing is, if we do the repeated surgery, there are chances that the ovarian tissue also get damaged, and there is decrease of the ovarian reserve. So it is the call of the infertility specialist whether to do the surgery or to proceed with the IVF. Repeated surgeries are also not advisable until unless if the endometriotic cyst is very big enough, like it is more than 4 centimeter, then we advise the patient to undergo surgery. So always surgery is not needed. How does the endometriosis impact our fertility, and what are the treatment options? That's what I said. The treatment options are to reduce the pain, we give the painkillers and hormonal injections. And for those who desire fertility, who want to become pregnant, there are other treatment modalities like trying with the IUI, or going for the surgery to remove the endometriotic cyst, or the best option is to go for IVF. So miscarriage last week at 5 weeks. So see, what happens in miscarriage is like we do the DNC, and there are symptoms like this endometriotic condition. Usually, what happens is there is the reversal flow of the blood from the endometrium. So this is diagnosed after the miscarriage. What is the reason? Means this is because of the back flow that might happen. Maybe the reason of this endometriosis. Heavy, irregular, and painful periods at the age of 14. See, this is very, very important for those, for the school-going girls, and early treatment is better to preserve the eggs, as well as if you are like now you are 30, trying since 5 years, recently diagnosed with stage 3 endometriosis. So definitely you require the infertilities, you need to consult an infertility specialist to get evaluated. If it is stage 3 endometriosis, don't delay. Get the treatment at the earliest, and the best treatment is the IVF. Can you get pregnant with endometriosis? Definitely, but the earlier diagnosis and the treatment is the best, because before the ovarian reserve, before it get delayed, like before it decreases the ovarian reserve, better you get the treatment. So at the earliest, take the treatment, and there are chances that you, even though the endometriosis is there, the pregnancy might happen. After my surgery for endometriosis, pain came back in 1 year. Will it keep coming again and again? What should I do? See, this endometriosis have the potential that it can reoccur. That's why we advise the patient to have the long-term follow-up. And there is no cure for endometriosis. Only we can subside the symptoms. Only we can subside the endometriotic spots by giving the medication. So there is no permanent cure for endometriosis. Okay, any other questions? I hope I have given a clear picture about the endometriosis and infertility. And next week we will again meet with one more interesting topic. Uh, Signing off. Bye bye.